Hello, and welcome to Module 1 of our Matrix Documentation Training. In this module, we will discuss the use of ASAM in the matrix enrollment process. Experience has demonstrated that certain factors impact an individual's success in the matrix, some of which are assessed using the ASAM. Each dimension has a potential severity rating as well as its own stage of change that should be considered prior to admission into matrix, as well as reviewed throughout the program, as stages of change may vary and are nonlinear. Dimension 1, detoxification and withdrawal potential assessment. This dimension should review at minimum a client's primary, secondary, and tertiary substances of use, considering frequency, route of administration, and duration of use, as well as any familial influence, such as being raised in a culture of use, where this was fostered as the norm and coping skills were not modeled. This dimension addresses the client's ability to manage or cope with withdrawal without medical intervention or detox. If client is using benzodiazepines, alcohol, or additional opiates and reports fear of withdrawal symptoms, this should be considered in program placement prior to admission into matrix. This dimension also considers a client's current level of impairment. If the client is regularly assessed for active impairment in the clinic, they may need to be referred to detox or residential prior to being referred to the matrix program. This dimension also looks at the client's current attendance. If the client regularly misses dosing prior to matrix enrollment, this may be an indicator of their attendance in matrix, and we cannot treat someone who is not here to be treated, though attendance issues alone are not disqualifiers for matrix enrollment. Severity range appropriate for the matrix, 0 to 2, or a 3 or 4 after completion of a detox program. Potential referrals prior to admission, detox or residential. Dimension 2, biomedical conditions and complications. This dimension involves carefully considering any medical condition that could impact the client's attendance or ability to cope with withdrawal outside a medically managed environment, as well as their general functioning and ability to self-manage medical conditions. If a client has a condition such as diabetes, certain seizure disorders, or hypertension that could be negatively impacted by withdrawal, the client should be considered at higher severity, and we should review Dimension 1 again for appropriate scoring and placement. If a client has unmanaged health conditions that require frequent urgent care or emergency room visits, this could also impact their attendance. If a client has chronic health conditions that require frequent medical visits, this could impact their attendance as well. If a client has chronic pain, this could impact their ability to tolerate withdrawal or to focus on long group sessions. Severity range appropriate for matrix, 0 to 2, or a severity rating of 3 with concurrent case management if in preparation stage of change in this dimension and willing to engage. A 4 would not be appropriate without medical clearance. Potential referral prior to admission, primary care physicians, specialists, and community case management services. Dimension 3, emotional, behavioral, and cognitive conditions and complications. This dimension addresses the client's trauma history, current coping skills, current diagnosis or potential diagnosis of mental health conditions, suicide risk, homicide risk, history of incarceration, potential for upcoming legal issues, interpersonal relationship issues, current medication compliance with psychotropic medications, current involvement in mental health services, and need for mental health services. While neither a mental health diagnosis nor an untreated mental health disorder will disqualify a client for matrix. An unmanaged mental health disorder that is impairing a client's executive functioning may not only interfere with their treatment, but with the program. If a client may have upcoming legal issues that lead to incarceration and disrupt services, this may also be a consideration for timing, as the group dynamic changes with the addition or subtraction of new personalities, and the stage of change for the group may take time to adjust. Severity range appropriate for matrix 0 to 2, or a severity range of 3 with concurrent mental health services and case management if in preparation stage of change in this dimension. Never a severity rate of 4 without professional mental health clearance. Potential referrals prior to or concurrent with admission. Mental health assessment, counseling, anger management, DV services, in-clinic co-occurring group, dual diagnosis anonymous. Dimension 4, readiness to change. Matrix is a stage of change-based program. This is one of the most important dimensions in the assessment. While a client who is aware they have a problem but is unsure about treatment may be appropriate after weighing out the severity of other dimensions, an individual who is pre-contemplative may not be appropriate for this program yet and may not only struggle, but may cause disruption in the program for others. The client's internal versus external motivation should be considered as well as their own perception of their use and their perception of other people's views of their use. In other words, a client may be in denial that their use is problematic, but aware that their family sees it as a problem. Inversely, if the family culture has been one of use, the client may see their use as being a potential problem, but has family members that encourage continued use as a means of relating to the family dynamic. Severity range appropriate for matrix 0 to 2. A severity range of 3 or 4 may need additional interventions prior to referral. Potential interventions prior to admission, other outpatient program, internal OTP group, motivational interviewing to elicit internal awareness of substance use disorder, stage of change appropriate for the matrix, contemplation, preparation, or action. Dimension 5, relapse, continued use, continued problem potential. Here, we consider whether the client has current coping skills in place to manage cravings and distress, whether they have internalized the things they have learned in previous treatment episodes, or have they memorized the words and phrases. How many previous treatment episodes has the client experienced? How has their attendance been? And what have the outcomes been of these previous treatment episodes? Severity ranges appropriate for matrix 0 to 3, or a severity range of 4 after higher level of care or with assigned lower level of care referral. Dimension 6, recovery environment. The client's recovery environment plays a critical role in their potential for success. Understanding a client's direct environment and indirect environment, their support system, and their housing situation are key components of understanding their need for referrals. Clients with a higher volume of personal recovery support have a higher potential for early success, whereas clients whose primary recovery support is professional may need to build a personal recovery support to replace their system of use support. Potential referrals prior to or concurrent with admission, housing, DV assistance, DHS self-sufficiency, transportation services, recovery housing, and DV housing. Severity range appropriate for matrix 0 to 3, or a severity rating of 4 with concurrent case management services if client is a willing participant and motivated, seen as being in preparation or action stage in this dimension. Please note, do not fit the assessment to the criteria. Be honest in your assessment so that the client may receive adequate and appropriate care. It may be that this assessment will indicate that another level of care is needed, and that's okay. For clients to be successful, they need to be placed in the appropriate level of care. That's our priority. Clients should be afforded every chance at success and placed in the least restrictive, appropriate level of care. If a client qualifies for detox or residential and is refusing higher level of care in favor of trying IOP, this should be clearly documented in a declined referral to residential services signed by the client, and they should be made fully aware that our recommendation is a higher level of care, and they are electing a lower level of care with an agreed date to review this decision again if progress is not made. You have reached the end of this video. Please be sure to take the quiz in this module and enjoy the bonus video on using a strength-based approach.